live transmission 31st of January 2025. Thank you all for being so loyal and for seeing our live transmission every week. We do have many cases. This Friday. The usual 6 cases and our weekly ultra posts. Let's start in the panel videos. Let's start with our panel videos. And let's go to our, yes, this is our first case for today. Our first case was an hemorrhagic cyst, ovarian hemorrhagic cyst, fetal ovarian hemorrhagic cyst. Do you think of torsion in this case or not? This is the question. Actually, the case I did urge the physician not to delay the delivery for this female fetus for fear of torsion, and postnatal ultrasound revealed that it's an ordinary hemorrhagic cyst with no signs of torsion for this ovary, and the baby was delivered safely with no implication regarding the ovary. But I do acknowledge that this is a worrisome image, because it gives the appearance, could raise suspicion for torsion for this fetal ovarian hemorrhagic cyst. The ovary may be torsioned or not, but we should always be careful in our reporting, because in a case like this, we know that the third trimester is the most common trimester for the ovarian cysts to appear. So if it's hemorrhagic and if it's troublesome like this ovary, I think we should alert the obstetrician for the possibility of torsion in a case like this. Let's see the comments on this video. They were lovely comments. Yes, hemorrhagic. Complex, yes. Big ovarian cyst, it could be an hemorrhagic. Yes, thank you, Mr. Dr. Salvatore. Thank you, Dr. Ala. But it was not kidneys, it was a hemorrhagic cyst. Yes, we are drawing attention, yes, to the people for the interactions. Thank you, Dr. Ala. You're always having lovely comments. Thank you very much. Yes, hemorrhagic ovarian cyst. And like we said, no comment is left. I do cherish every comment. So thank you all for your lovely comments. Okay, let's go back to our cases. Case number 5, yes, 654321. A case classic hygroma with hydrops in query female fetus which is rising to a monosomy X or Turner syndrome, or cystic hygroma in female fetus, query monosomy X, query Turner syndrome. It was very lovely comments. Thank you for all the comments. Let's let's respond to all the comments. Like I said before, no comment is left, and I do cherish every comment. Thank you, Dr. Ala, for the lovely comments. Dr. Wafa, thank you very much. Let's go back to our fourth case. Our fourth case was an easy case, but it does go missing. It does go missing for many colleagues. We do have here two fetuses with one of them is showing an acrania and Iniencephaly sequence, and the other is having a normal skull. So, as we said before, could it pass upon anybody, especially if the mother is somehow slightly obese here, or this is the case, the resolution of the machine was okay, but the mother is having some sort of obesity. So the subcutaneous fat could lead to shadowing over the skull bone. And always ask yourself, could you do measure here a biparietal diameter like you should? And I do understand that the first trimester is always hard to identify the shadow of the skull bone. But it's a good example of, exactly in this case, it's a good example that you should take care closely of the okay. Before going further in this, we do have an we do have the tradition of changing our, like we have said, we do change the blog. We do, twin fetal reduction. Yes, the answer is fetal reduction. We will take this from Dr. Amjad Badran and go and edit here the title of the video, because I don't have any other time to adjust this one. I don't have any other time to, you see, even your comments on my video is helpful for me to change my blog, one with acrania. Yes, I do. I'm changing now. Acrania and Iniencephaly sequence. Iniencephaly sequence. And this is the right name for this twin dichorionic diamniotic, one with acrania and Iniencephaly sequence. Okay, let's go back and change other videos that we have seen. This is our tradition. We will stick by it, because like I've said, you are helping me to change my or to update my blog, because I don't have any other time to do it. Yes, this is the one. We'll change it to fetal ovarian hemorrhagic cyst. Okay, let's go back to our third video. Which was our third video. I hope you do like the render that I'm doing in the beginning of the videos. This render, I guess it's helpful. Let's like cystic hygroma and hydrops fetalis. And Turner syndrome. In query, yes, we do write in query Turner syndrome. Query monosomy X. Yes, okay. We did have we did answer and change our first 3 cases, 1, 2, 3. And let's go to the most important case of the week. Our most important case of the week. Our most important case of the week is a lovely case that is showing left atrial isomerism. And the left atrial isomerism here, we do have morphologically 2 left atria with an AVSD surely. And 2 vessels are noted in front of the spine behind the heart, the aorta, and the enlarged azygos, which is arising due to the interrupted inferior vena cava with drainage, enlarged coronary sinus draining into this azygos with an total anomalous pulmonary venous stern coming with it. It was a very, very, yes, left atrial isomerism with the supracardiac total anomalous pulmonary venous stern. Yes, bravo, this vein, superior vena cava draining into the right atrium. Here, comments from Dr. Vladimir, mesocardia AVSD, yes, 2 atrial appendage, left atrial, the double barrel sign. This is the double barrel sign or the double vessel sign. The double barrel sign or the double vessel sign. You give me right here, right now, the idea to change it, to change the my blog. I will go to my, yes, we'll go to my website and show you the and show you in my website here. Yes, this is the one, double vessel sign, left atrial, and I need to comment all say double barrel sign and left atrial isomerism heterotaxy, which is the most important sign that you can by it surely suspect that there is something abnormal, or you are going to see a case of left atrial isomerism or heterotaxy. This was the topic of our weekly ultra post, and let's take it. Yes, double barrel, we take it from Dr. Vladimir Lemire. Yes, we will post with here. I will change this. Yes, let's change, only put an yes, double vessel with execute. Yes, let's write barrel, double vessel or double barrel sign in left atrial isomerism. This is, you can see, yes, my article here on my website, or you can go simply to LinkedIn. You can simply go to LinkedIn. Yes, and I will yes, let's comment by that, and I will go here for Doctora Ala, and I will mention you with the weekly ultra posts. Let's also mention Dr. Vladimir in our weekly ultra posts. And hereby Dr. Noor also did a very good explanation of this case. Dr. Noor did a very good explanation of the case. And I'm commenting here with the double vessel sign. And Dr. Iqbal did a very good comment. Dr. Zohra, yes, let's put a very good comment for Dr. Zohra. And Dr. Nival from Turkey. Yes, thank you. Yes, a very wonderful comment that you all need to see. I did support this comment. And yes, left atrial isomerism, both appendages are left atrial, a prominent azygos suggesting interruption of the inferior vena cava, unbalanced AVSD, congenital heart block with ventricular ectopics. This is another very important note, that there is congenital heart block associated with the left atrial isomerism with cardiomegaly and ascites. And yes, we will go and change right here, right now. I guess this is the most important case of the week by far. This is the most important case of the week by far. Yes. We will take this one and let's go change. Thank you always for all your comments. They were wonderful comments. And let's go change my blog here on YouTube. Fetal echo. Yes, this was a very important case. If you do, if you need to see more about the left atrial isomerism, go check the case which I did put in the comments for our colleagues. I did put this case for comments. This one. Yes. Click on this link and you will see another lovely case of left atrial isomerism. Thank you, Dr. Noor. Please go see we are live now. Please go see the live and enjoy the case. Okay, let's go back to our, I guess, fifth case. Let's go back to our fifth case. Yes, I also cherish this case is a very important case. Take care from something. We do have here something like an encephalocele, but also we do have a marked retroflexion of the fetal head with an interrupted spine, short spine, abnormal shaped spine. Is it spinal dystrophism? So we do have an Iniencephaly with cervico-thoracic vertebral fusion with this encephalocele noted. So it's a case of Iniencephaly with rachis. It's a case of this is the second most important case for this week. Iniencephaly with rachis. Yes, and this was the most exclusive, most lovely, most ravishing comment for my cases this week from Dr. Ala. The defect in occipital bone, bravo. Spina bifida of cervical vertebra, you can think about that. It's very rare, but it's, yes, something to see. Retroflexion, backward bending, bravo, Dr. Ala. Of the head, cervical spine, extended spinal dystrophism, yes, rachis. Incomplete development of the spine with posterior opening of the vertebra. This is a comment to study. This is a comment to study. This is a very important comment from Dr. Ala. And you can see another case here in the comments in LinkedIn. Please join LinkedIn if you are not on LinkedIn. This is a very respectable platform very scientific with no BS from Facebook. So see the rhexischisis totalis, another case of rhexischisis totalis with iniencephaly. And hereby I do mention Dr. Akbal to see this lovely comment. Yes, also this was a very good comments from all my colleagues. And let's mention here by mention him, and please go see the live for more insights. Okay, let's take from Dr. Ala this let's take this one. Yes, iniencephaly with rhexischisis with cervical spina bifida. This is what we will change our blog. Yes, it's a very important step. The channel is for all of you. You can always mention me and use these cases in your teaching material if you are doing so. With, yes, you can call it cervical spina bifida, which is very rare. This is right, with the cervical fetal ultrasound. So thank you for these lovely comments. It's all right. So let's go back to our cases, and hereby you will see the last case. It's an important case for me because I do see this, and I did use the superficial probe. I did use the superficial probe. So I can show you the dilated jugular lymphatics and the second nuchal fold with septation. If you can see in a case dilated jugular lymphatics only, with dilated jugular lymphatics only, with no thickening of the nuchal fold, so it's a subtle finding and that will resolve spontaneously. But if you do see the dilated jugular lymphatics associated with thickening in the nuchal fold or the nuchal translucency, this is something showing a high risk for trisomy. So I did respond here with a case of dilated jugular lymphatics only, maybe showing or not showing the second NT, so this case will be perfectly normal. But the dilated jugular lymphatics, like Dr. Naval is saying, I don't say it's a cystic hygroma, I'm saying it's second nuchal translucency. Second nuchal translucency only. It's not a cystic hygroma because it's not taking a circumferential or all around the neck. It's only taking a localized part of the posterior part of the. So I will put this as the final comment. Yes, we will put this as the final comment in our blog. We will edit here. Dilated jugular lymphatics and second anterior sections, fetal ultrasound. This is the final diagnosis, waiting for the lab. I did ask the patient for laboratory sampling, either NIPT or amniocentesis. We will update you. So thank you, my friends, for this lovely discussion. I hope you did enjoy our cases for this week. See you next week with other cases. If you did like this live, please leave me a comment. You are encouraging us to continue. Thank you very much. And tell me, where are you from?